This is NDTV, and you're watching NDTV 24/7.
Good evening. India is going to enter lockdown 3.0. If you're just joining us, that is the breaking news at this hour. The lockdown, the nationwide lockdown, has now been extended for the second time for 2 weeks till the 17th of May now, starting from the 3rd of May. So that's Monday. So what the lockdown 3.0 means for you depends on where you live. All districts of India have been divided into red, green and orange zones, and considerable relaxations have been allowed in the orange and green zones. In fact, even the red zones that have been categorized as hotspots by the government, we'll see a large number of activities that are being allowed there, from industrial and construction activities in rural areas, including Manrega works, food processing units, brick kilns, etc. Now, I just want to step back for a second while probably some of the numbers, the factors that have been taken into consideration as the government has decided to extend this lockdown into the third phase, into the 3.0, is that a number of COVID-19 hotspots or the red zones across India have reduced from 170 to 130. That is over a span of 2 weeks. And of course, that was seen as a major achievement due to the lockdown. That's what the government had declared a few days ago. However, a matter of concern is that the number of green zones, that is the districts that are reporting no new cases in the past 21 days, have also decreased. And the number of orange zones where no new coronavirus cases have been reported in the past 14 days have increased. So keeping that in mind, let's speak to our doctors today, our experts in the studio, about what we need to do over the next 2 weeks and further to keep ourselves and our loved ones safe. And today on this show, we have our experts, Dr. Alok Kanungo. He's a diabetes specialist joining us from Bhubaneswar. And we also have Dr. Aniruddha Dharmadhikari, who is an interventional cardiologist from the NDMVP Medical College in Nashik. So first, perhaps Dr. Kanungo, I want to first ask you, the fact that orange zones are increasing across the country, red zones are coming down. So what we're saying in India is that the hotspots, the places where we're seeing a huge spread, we're seeing people dying in red zones, those are coming down. But coronavirus is still spreading slowly over a wider area. Keeping that in mind, what does one need to do as the government has gone into an extension of the lockdown? This is the time to remind ourselves that we have to continue to be safe, that we have to continue to wash our hands, keep social distances from one another.
Yes, Sarah, good evening. This is a very important phase in the COVID-19 problem in our country and everywhere in the world. Virus is not going to go anywhere, at least for years or maybe more than 1 year. Whether government is implementing lockdown or no lockdown, each individual, each family must follow the golden guidelines of keeping themselves fit. They must this hand washing for 20 seconds by soap, sanitization, maintaining distance, self-distancing at least 1 meter, and not coming in contact with the probable cases who are sneezing or all those things has to continue. And in the marketplaces, in the office places, we must maintain all these things.
Okay.
Otherwise, virus is invisible.
All right. So this is the note that we should start this show on. The lockdown has been extended, but the restrictions are being eased up. But this is no time for all of us in our own individual lives to ease up on the precautions that we've been taking over the past month. Great start to the show, Dr. Alok. Let's go across to our first caller. We have lots of callers lined up. So Subbarao from Hyderabad joins us. Subbarao, what's your question? Dr. Dhar, maybe you can take that.
Yeah, sir, good evening. I'm Subbarao from Hyderabad.
Go ahead, Mr. Subbarao.
Yes.
Yeah, sir, I have two questions. One is recently, just now, the government has allowed red zones, green zones, and orange zones of certain activities.
Yes.
Yeah, certain activities, and all the doctors and OP patients and hospitals are closed. So whether the lab tests also been closed.
Hello?
Other than the corona virus, what they have to do, sir?
Okay, Dr. Dhar, I don't know if you've had a chance to look at the MHA statement, but from what I have understood, it looks like there is easing up also of non-COVID related medical treatment. So I think what they're saying is that OPDs can open and you can get treated, which in the past was much harder for somebody who was having, let's say, diabetes, dialysis, etc. They all were facing a lot of trouble. But your response now to this question, would you be able to help Mr. Subbarao from Hyderabad, who's concerned that people who are having non-COVID related illnesses are not being able to get treatment?
I'm running a hospital in Nashik, and we have had a steady stream of patients in the last 1 month. Those patients who require emergency attention are definitely given whatever is required. It's a multi-speciality hospital, predominantly catering to cardiac patients, but we are functioning. Whoever comes to our doors is attended and properly treated. They get the required medicines. It is not a problem. Because if they carry their files with them, even with the lockdown, the police do allow these patients to reach the hospital, because there are many patients who are scheduled for dialysis or chemotherapy or for cancer, and they don't miss it. We are running our facility completely without any hindrance, and our patients don't face any problem. It is only the question that you should take the fear out from your mind and go and approach the hospital which is convenient to you and get your treatment done. It should not be a problem. The labs are also functioning completely.
All right, so Subbarao, also, you know, the new restrictions that have come in that allows taxi services, for example, to run, albeit with one passenger. Auto rickshaws can now run with 2 persons only in it. That will also possibly help anyone who has been wanting to get medically treated or checked up, but has been staying at home over the last month because they haven't really, it hasn't been easy for them to get to these hospitals which are running. It might actually help them over the next 2 weeks as we go into lockdown 3.0. All right, Pankaj from Mumbai joins us. Pankaj, what's your question?
Yes, madam. Good evening. Pankaj from Mumbai. We have 2 tests. One is a swab test and the other is a serum test for corona virus testing. Now, we often get false positive and false negative results. How many times do we undergo testing to get a 100% confirmed result that is truly positive and truly negative? Also, the public health system is creaking and there are a number of shortcomings. The budgetary provision is just about 1.2% of the GDP. The public sector banks have a huge pile of NPA running into lakhs of crores. Rogue businessmen have their debts written off running into thousands of crores. Instead, government should give priority to help to improve the public health system and increase the budgetary provisions for health from a meager 1.2% of GDP to 6%, if not 10%. Do you doctors, along with the media, agree on this point?
Dr. Alok, a very impassioned viewer over there saying that we don't have enough funds that a country like India needs, and this has only been highlighted now in the middle of this pandemic.
Yes, Mr. Pankaj, you are right. And in India, the number of tests that we should do, we are not able to do. In a population of 130 crores of people, we are not able to do adequate tests, and particularly these quick tests, which are antibody tests, they are sometimes becoming false negative or false positive. And that is a big concern now for the ICMR and Government of India, and they have returned the kits. And for the RT-PCR, that is 100% correct, and there is nothing wrong in that. and we increase the number of RT-PCR tests in many centers, then that will be much better for our people. Now there will be free mixing of people, migrant laborers are coming back, so more number of tests is required. And regarding health budget, we doctors, we can't do much about that. That is the thinkers, politicians, and they should think over this. Economists, RBI, they should think over that. But as I feel, no more number of test, that is required for India and for such a huge population.
A
Then
very
only
good
we
point,
can
sir. On a
control.
day when the government has declared that trains will start running, they've actually already started, and migrant labor are being taken back to their home states. So very critical point that you've raised there about the need for more tests now in the next 2 weeks. Let's quickly go for a short break. Let's come back. We'll have our viewers after that with more questions for you, doctors. Welcome back. You're watching our call-in show where we bring you the best in the business, the best doctors to answer all of your questions, your concerns about the spread of the coronavirus. Let's quickly go across to Manjeet Singh from New Delhi. Manjeet, what's your question? Do we have Prakash from Ranchi? Maybe we can try Manjeet again. Okay. Manjeet, just start again. What's your question? Can we turn him up also? All right. We seem to be having some trouble getting Manjeet Singh from Delhi. Let's give it another shot. Meanwhile, doctors, now as we know, the breaking news is that the lockdown has been extended by another 2 weeks, yet we're seeing restrictions ease across the country. Okay, hold on. I do have Prakash from Ranchi joining us. So Prakash, go ahead with your question.
So, ma'am, my question is that given that 80% of the cases in India are asymptomatic cases, so wouldn't it be wise that first the population of such green/orange zones are subjected to some kind of pooled antibody testing before such zones are earmarked for relaxation? Because the fear of the second wave hitting us is much higher if we have a false sense of zone immunity.
Well, that's actually what Dr. Aniruddha was just pointing out, or was it Dr. Alok? But Dr. Alok, can you come in over there? This viewer pointing out that orange zones are increasing, green zones are reducing. So the focus needs to be on testing then.
Just after the lockdown is over, we'll have much more cases, and that is a rule everywhere now. And that is why we need this antibody test much more frequently with more sample size, and selective groups should be tested, and the test should be reliable and viable. That is why Government of India must ensure that more number of antibody tests should be done, and from that we can pick up. The antibody test do not say that you have the COVID-19 at present, but you had some exposure and you have antibodies. So that will give us a lot of more positivity. And as Prakash is telling, these zones can be more clarified, and orange and green should be more clarified, and people can be protected. So more number of tests are really required by the state governments and central government, at least the antibody test.
All right. Dr. Aniruddha, if you can also come in on that, because we're at a critical stage now. The government has extended the lockdown, but it's increasing and easing up the restrictions, especially if you're in an orange and a green zone. But you as doctors are pointing out that this is not, we're nowhere close to the finish line. We have to continue to enforce that we protect ourselves individually and our families, irrespective of the decisions that are made on a national level by the government to ease up on restrictions, perhaps possibly with an eye on the state of the economy. Dr. Aniruddha.
Well, restrictions or easing of restrictions. Both the policies of the government can only be successful if we, as a population, follow certain rules, certain guidelines, and cooperate with the government. Because the government intends to restrict the spread of the disease in our country, and we should definitely follow the guidelines laid by the government, whether it is a red zone, orange zone, green zone, whatever relaxations they have just offered. We need to follow them, and we have to take personal care of our family, and wherever we go, we have to maintain physical distancing so that the virus spread can be contained, and the chain of virus infection should be broken. That is the intention of lockdown, and easing the lockdown is necessary for obvious reasons. And easing doesn't mean that everything comes back to normal, because as Dr. Alok has rightly said, the virus is not going to die.
Yeah.
The virus is going to persist, like the Spanish pandemic which occurred in 1918. It occurred on a very large scale for 3 years, and then subsequently, in a low grade, the infection is still persisting in the world.
Yeah. Yeah.
Similarly,
Okay.
we can...
Okay,
Yes,
so the lockdown the restrictions may be eased, but we need to be smart, we need to stay safe and calculate every step you need to take over the next few weeks. Just because restrictions have eased up, think again about whether you really want to do or need to do whatever you are, maybe wanting to take advantage of those eased up restrictions. Thank you so much, our doctors tonight on the show, for joining us to answer your questions. Stay tuned to NDTV. Will bring you go in depth into the new restrictions and the easing of restrictions and the extension of this lockdown 3.0 and what it means for you, coming up on the news at 8. Bye-bye.